The year was 1484. In a dimly lit chamber in Cologne, a woman named Margareta writhed in agony as three robed physicians prepared their instruments. Her crime was not theft, nor murder, nor heresy. Her transgression was far more sinister in the eyes of medieval medicine. She had experienced sexual desire. The lead physician, Johannes Hartlieb, carefully heated an iron rod until it glowed orange in the flickering candlelight. "The corruption must be burned from her womb," he declared solemnly. "Only through fire can we restore her natural humility and cure her of this masculine affliction." Margareta's screams echoed through the stone walls as the searing metal was inserted into her body. The other physicians nodded approvingly, documenting every detail for their medical treatises. They genuinely believed they were saving her soul, restoring the natural order that God had intended. According to their training, a woman who experienced pleasure during intercourse had allowed demonic forces to corrupt her feminine essence. This was not torture. This was medicine. The procedure lasted 3 hours. When it was over, Margareta was declared cured of her hysteria and excessive heat of the womb. She would die from infection 6 days later, but the physicians recorded the treatment as a success. After all, she had shown proper feminine submission in her final moments exactly as nature intended. What happened to Margareta was not an isolated incident of medieval cruelty. It was part of a systematic, scientifically justified campaign of medical torture that spanned nearly 1,000 years across Christian Europe. Medieval physicians trained in the most prestigious universities and blessed by the highest church authorities developed an entire branch of medicine dedicated to correcting female nature through pain, mutilation, and psychological destruction. These were not primitive barbarians operating in ignorance. They were the intellectual elite of their time, scholars who could read Latin and Greek, who studied the works of Galen and Hippocrates, who corresponded with the greatest minds in Christendom. Their medical practices were documented, peer-reviewed and taught in universities from Paris to Bologna. They created detailed anatomical drawings, wrote comprehensive textbooks and established medical schools that would influence European medicine for centuries. The truth that emerges from their own meticulously kept records reveals a horror that surpasses fiction. An entire civilization convinced that women's bodies were fundamentally diseased, that feminine sexuality was a medical emergency, and that the cure required breaking the female spirit through calculated suffering. The documented methods they employed, the reasoning they provided, and the systematic nature of their approach reveals a level of institutionalized cruelty that makes modern torture seem crude by comparison. This is not a story about the Dark Ages. It is about the birth of scientific misogyny, where hatred of women was dressed in the respectable robes of medical authority. Medieval medical theory was built upon a fundamental principle that would dominate European thought for over 8 centuries. Women were inherently diseased versions of men. According to the medical textbooks taught at the University of Salerno, and later throughout Christian Europe, the female body was nothing more than a failed attempt at creating a malia biological mistake that resulted in perpetual illness. The leading medical authority of the 12th century, Constantinus Africanus, established the theoretical foundation in his medical compendium, De Gynexia. He wrote, "The female is colder and moister than the male, lacking the natural heat necessary for proper human development. This deficiency creates a state of permanent corruption within her womb, generating toxic vapors that poison her blood and corrupt her mind." This wasn't merely theological speculation. It was considered established medical science. Physicians diagnosed women with womb fury, furor, uterinus, a condition they claimed caused the uterus to literally wander throughout the body, pressing against other organs and causing hysteria. Seizures and moral corruption, The prescribed treatments were designed to force the wandering womb back into its proper position through pain and terror. The medical schools of medieval Europe taught that menstruation was evidence of internal rot, that women's monthly bleeding was the body's attempt to expel the poisonous substances generated by their inherently corrupt nature. Physicians like Albertus Magnus wrote detailed treatises explaining how this female sickness contaminated everything. A menstruating woman touched spoiled wine and milk and could kill plants merely through proximity. But the most sinister aspect of medieval gynecology was the treatment of what physicians called uterine suffocation, any sign that a woman experienced sexual desire or physical pleasure. Medical texts describe this as a disease that transformed women into beasts, causing them to lose their natural feminine modesty and submit to carnal appetites like men. The cure, according to established medical doctrine, required destroying a woman's capacity for sexual pleasure entirely. The procedures they developed were nightmarish in their precision and cruelty. The medieval physician's toolkit for treating female patients contained instruments that would make a torturer envious. These devices were not crude implements of pain. They were precision medical instruments crafted by skilled metalworkers and blessed by church authorities before use. The matrix corrector was perhaps the most commonly used device for treating hysteria. This iron instrument, heated until red-hot, was designed to be inserted deep into a woman's body to burn away the corrupted flesh that generates excessive heat. Medical texts from the 13th century describe the proper technique in clinical detail. The corrector must be inserted slowly, allowing the patient to feel each increment of purification. Her screams indicate the demon of lust departing from her womb. For cases deemed more severe, physicians employed the virginity restorera device with internal spikes that was inserted and then slowly expanded. The medical reasoning was that women who had experienced sexual pleasure had opened themselves beyond their natural feminine state. The spikes would create internal injuries that, when healed, would restore the patient to her original pure condition. The procedure typically took several hours and was performed without any form of pain relief, as physicians believed that anesthesia would interfere with the healing process. Hildegard of Bingen, considered one of the most progressive medical minds of the 12th century, documented the use of womb clamps for treating women who showed signs of sexual appetite during marriage. These metal devices were inserted and locked in place for periods ranging from weeks to months, preventing any possibility of physical pleasure while allowing for reproduction. Hildegard wrote, "The female who seeks pleasure in the marital act has forgotten her proper nature. Only through constant discomfort can she remember her divine purpose as vessel, not participant." The most horrifying aspect of these treatments was their systematic nature. Medieval hospitals maintained detailed records of each procedure, tracking which methods were most effective at producing the desired behavioral changes. The Hospital of Santa Maria Nuova in Florence kept meticulous notes on over 3,000 female patients, treated between 1350 and 1400, documenting success rates, optimal duration of treatments, and post-procedure behavioral modifications. The physicians were particularly proud of their innovation in combining physical torture with psychological manipulation, creating what they termed therapeutic shame. Medieval physicians understood that breaking a woman's spirit required more than physical pain, it demanded public humiliation that would destroy her sense of self-worth and social standing. They developed elaborate procedures that transformed medical treatment into performances of female degradation, conducted before audiences of medical students, clergy and paying observers. The examination of corruption was a standard procedure for any woman accused of experiencing sexual desire. The patient was stripped naked and placed on a raised platform in the centre of a lecture hall, while physicians provided detailed commentary on the visible signs of her moral decay. Medical texts from the University of Montpellier describe how professors would point out the enlarged passages that indicate excessive use, the darkened flesh that reveals inner corruption, and the signs of demonic possession in her private areas. These examinations could last for hours, with different physicians taking turns to demonstrate various techniques for identifying female depravity. Students were required to take notes and ask questions, transforming a woman's body into a living textbook of moral corruption. The psychological impact was the point. The medical establishment had learned that shame was often more effective than physical torture in permanently altering a woman's behaviour. For married women who were reported by their husbands for showing excessive enthusiasm during intercourse, physicians developed the correction of marital duties. This procedure involved inserting instruments designed to cause pain during any future sexual activity, while the woman's husband was required to witness the treatment. The physician would explain in detail how the devices would ensure that the woman could fulfill her reproductive obligations while being incapable of experiencing sinful pleasure. The medical records from the Hospital of Santo Spirito in Rome reveal the systematic nature of these humiliation rituals. Between 1300 and 1450, the hospital treated over 2,000 women for sexual corruption, with detailed documentation of each patient's public examination, the specific instruments used, and the behavioural changes observed in follow-up visits conducted months or years later. The physicians took particular pride in their ability to break women who had shown intelligence or independence, viewing such cases as the ultimate test of their medical skill. The most sophisticated aspect of medieval gynecology was not the physical torture. It was the psychological techniques designed to permanently alter a woman's personality and self-perception. Physicians developed detailed protocols for what they called cognitive correction, systematic methods of destroying a woman's capacity for independent thought or self-assertion. The process began with diagnostic conversations designed to identify the root causes of a woman's improper behaviour. Physicians would spend hours questioning patients about their thoughts, dreams and secret desires, carefully documenting any signs of intellectual curiosity, sexual awareness or personal ambition. These sessions were conducted in front of scribes who recorded every word, creating permanent records of a woman's most intimate thoughts and fears. Master physician Arnaldus de Villanova developed the most influential treatise on female psychological correction, De Reprobis Mulierum, on the corruption of women, which became required reading at medical schools throughout Europe. His methods combined physical torture with carefully crafted verbal humiliation designed to convince women that they were inherently evil and that their suffering was both deserved and necessary for their salvation. The mirror of corruption was one of his most effective techniques. Women undergoing treatment were forced to look at their own reflections, while physicians pointed out every physical flaw, describing how each imperfection was evidence of inner spiritual decay. They were made to repeat phrases like, "I am corrupt in body and soul. My desires are the devil's work, and only through pain can I approach purity." This could continue for days or weeks until the woman internalized these beliefs completely. For educated women, those who could read or who had shown interest in learning, physicians developed special protocols designed to destroy their intellectual confidence. They would be given impossible theological questions to answer, then subjected to physical punishment when they failed. Medical texts describe how this technique was particularly effective with prideful women who had forgotten their proper ignorance. The records from the convent of Santa Margherita in Venice show how successfully these techniques worked. Of 200 women treated between 1400 and 1450-87, showed complete behavioural transformation within 6 months, becoming what physicians described as properly submissive and naturally fearful. The most chilling aspect of these records is how they document the systematic destruction of human personality as a medical achievement. By the 14th century, the treatment of female disorders had become one of the most profitable branches of medieval medicine. Physicians discovered that there was enormous demand among husbands, fathers, and religious authorities for procedures that could guarantee female compliance and eliminate any signs of independent will or sexual autonomy. The medical establishment developed a sophisticated pricing structure for different types of female correction. Basic hysteria treatment cost the equivalent of a skilled craftsman's monthly wages, while more complex procedures like complete personality revision could cost as much as a small farm. The most expensive treatments were reserved for women from wealthy families who had shown signs of intelligence independence or sexual awareness, conditions that were considered particularly threatening to the social order. Physician Giovanni da Vigevano established the first specialized clinic for female correction in Milan in 1335, offering a comprehensive menu of services, ranging from simple modesty enhancement to complete feminine reconstruction. His detailed account books, preserved in the Bibliotheca Ambrosiana, reveal that the clinic treated over 500 women annually and generated enough profit to fund the construction of 2 new hospitals. The business model was ingenious in its cruelty. Physicians would often recommend multiple treatments spaced over months or years, arguing that female corruption was so deeply rooted that it required ongoing medical intervention. They developed maintenance procedures designed to prevent the return of improper thoughts or desires, creating a steady stream of repeat customers who lived in constant fear of their next appointment. The most profitable segment involved treating women who had been denounced by neighbours' servants or family members for signs of sexual impropriety. Canon law required that such accusations be investigated by medical professionals and physicians learned to find evidence of corruption in virtually any woman brought before them. The examination fees alone were substantial, but the real money came from the extensive treatment programs that invariably followed hospital records from across Europe, show the staggering scale of this medical industry. The Hospital of San Giovanni in Florence treated over 1,000 women for sexual and moral disorders between 1300 and 1500, while the Hospital of Santa Maria in Paris documented nearly 15,000 cases during the same period. The physicians had discovered that the systematic brutalization of women was not only socially acceptable, it was highly profitable and professionally prestigious. The most disturbing aspect of medieval gynecology was not the cruelty itself, but the genuine conviction among physicians that they were performing acts of healing and mercy. These were not sadists or monsters, they were respected members of society who saw themselves as healers, protectors of moral order, and servants of gods. The medical texts reveal a profound contradiction at the heart of medieval medicine. The same physicians who developed elaborate theories about female inferiority also acknowledged women's crucial role in society as mothers, caregivers, and spiritual guides. They genuinely believed that by torturing women into submission, they were protecting both the women themselves and the broader community from the dangers of uncontrolled female sexuality and independence. This contradiction appears repeatedly in medical writings. Physician Peter of Spain, who later became Pope John XXI, wrote extensively about the sacred nature of motherhood, while simultaneously developing techniques for destroying women's capacity for sexual pleasure. He argued that these treatments were necessary to preserve the purity of maternal love, claiming that women who experience physical pleasure during conception would give birth to morally corrupted children. The medical establishment also created a complex theological justification for their practices, arguing that female suffering was redemptive, and that physicians who inflicted this suffering were participating in God's plan for salvation. They pointed to biblical passages about women's inherent sinfulness and the necessity of pain in childbirth as divine endorsement of their methods. Perhaps most chilling of all was the way these physicians documented the gratitude of their patients. Medical records frequently note that women thanked their torturers after treatment, expressing relief at being cured of their inappropriate desires and restored to proper feminine virtue. The psychological manipulation had been so complete that many women genuinely believed their suffering had been necessary and beneficial. The Hospital of Santa Croce in Bologna maintained a collection of letters from former patients, praising their physicians for saving them from themselves and restoring their natural feminine nature. These testimonials were used to train new physicians and justify the expansion of treatment programs to other cities. The success of these psychological techniques reveals the most horrifying truth of all. The medieval medical establishment had perfected the art of making women complicit in their own destruction. The legacy of medieval gynecology extends far beyond the Dark Ages. Its influence shaped medical attitudes toward women for centuries afterward. The fundamental assumption that women's bodies were inherently diseased and that female sexuality required medical correction persisted well into the modern era, influencing everything from Victorian treatments for hysteria to 20th century psychiatric practices. The meticulous records kept by medieval physicians provide an unvarnished look at what happens when systematic hatred is disguised as scientific knowledge and moral authority. These were not ignorant barbarians, but educated professionals who created an entire medical specialty dedicated to the systematic brutalization of half the human population. Their detailed documentation reveals not only the methods they used, but their genuine pride in perfecting techniques of psychological and physical torture. The most haunting aspect of this history is not the cruelty itself, but the institutional nature of the abuse. Entire universities taught these methods. Churches blessed these practices, and communities funded hospitals specifically designed to torture women into submission. The systematic nature of the brutality reveals a level of organized misogyny that challenges comfortable assumptions about human progress and moral advancement. The women who survived these treatments carried invisible scars that affected not only their own lives, but the lives of their daughters and granddaughters. The psychological techniques developed by medieval physicians were so effective at destroying female confidence and autonomy that their effects rippled through generations, creating cycles of submission and self-hatred that persisted long after the original medical practices were abandoned. In examining this dark chapter of medical history, we see the ultimate consequences of a society that views half its population as fundamentally defective and in need of correction. The medieval physicians who documented their treatments with such clinical precision left behind a testament to the horrors that unfold when hatred masquerades as healing, when torture is disguised as therapy, and when the systematic destruction of human dignity is celebrated as medical progress. What other civilizations throughout history have hidden their darkest practices behind the mask of legitimate authority and moral righteousness?